Today's webinar is about ready to begin.
Happy Thursday, everybody. My name is Summer Napier, and I'm the Director of Grassroots Advocacy here at NAHC. Thank you for joining our Grassroots webinar on understanding our government. Today, I wanted to introduce these guys that are on the webinar with me. Let's start with Kyle. Kyle is the Director of Government Affairs and Communications at the Home Care Association of Florida. You guys know Calvin and Davis. They need no introduction. I wanted to get started today with giving Kyle a chance to share his expertise and tell you guys about how he got into government affairs, because he brings some rich education to us today. And so we want to take a moment to introduce him. So Kyle, can you tell him a little bit about you?
Yeah, thank you, Summer. I have been in government affairs for about a decade now, most of that with HCAF, so working in the home care sector. But the political nerd in me goes way back. As a child, my dad worked in the newspaper business, so I would read about government and politics from a young age, and that was kind of like my sport. So I went into political science at Florida State University and got a master's degree in public policy from there as well. And since then, I've worked on political campaigns. I've worked for members of Congress, for a statewide organization that represented the President of the United States, and in home health care, of course. So it's a pleasure to be here. And I also teach U.S. government part-time. I've been doing that for about a decade now at a state college here in Florida.
Awesome. So everybody can definitely agree that we have someone knowledgeable along with Calvin and Davis on this call, so that we can teach our grassroots advocates a little bit about what they're going to be doing. So let's just get started. Let's start off with just simple questions. The purpose of this webinar is to get very granular and to give people a strong foundation to build on, because we want to create confident advocates here at NAHC. And what we mean by that is we don't want any of our colleagues to feel insecure when they walk in to talk about the things that mean the most to them. And sometimes that can hold people back. So we want to give them a deeper level of understanding of something they may not truly understand, so they can get their message across. So one of the questions that we're going to get started with is just, what is the difference between our state and federal government? Can you kind of take that, Calvin, or we'll start with you, Kyle. Can you tell us just some main characteristics or main differences that kind of set each of those apart?
Sure. So the federalist system creates a federal government and powers for each of the states as well, and then the local governments beneath that state. But basically what states have a lot more oversight or power, I guess there's more connection to the actual resident or the voter, in the various things they do on a daily basis, such as how you get licensed to be a nurse, how much you're going to pay for your college tuition. Those kinds of state level issues actually change state to state, whereas at the federal level, if you look at the Social Security system or the Medicare system, there are federal programs that are shared with the states, such as Medicaid, but the federal government, anything the federal government does supersedes what the states can do. So the states do have separate powers, but they have to be adherent under the Constitution to the federal government, as we're seeing with the COVID vaccine mandate for Medicare.
That's a great point. That's a great point. Calvin, let's jump to you real fast. Aside from what Kyle said, is there anything you want to add to that?
Well, I think it's important to kind of note that even though you have these differences Kyle just walked through, you still have state senators, state representatives versus federal senators, federal representatives, and those can often get confused, and it's easy to confuse them, but there is a difference there. And when we look at legislation, when folks watching this look at legislation, it's important to know, is this a state bill or is it a federal bill? Again, that stuff's so easy to get confused because you see a couple letters, some numbers, and it's going to do something that creates a law. So understanding that difference, I think it's a good first step in knowing where you go to either find more information, or if you want to advocate on behalf of that or against it, what your target will actually be with that.
Great. I'm going to push back some questions real quick. So you brought up a great point about there being a difference between state bills and federal bills and how they can get those confused. Let's say one of our advocates get an email from NAHC or a state association or some trade association, and they want their support on it. Take this to your legislator. How can they quickly differentiate, or is there a way that they can differentiate where that bill is coming from?
Yeah, from a federal perspective, it's easy. You just go to congress.gov. operates as any general search engine does. There's a search bar right at the top, and you can punch in, S100 or HR 250 or whatever it is, and that'll give you results. And all that's going to be federal results. So if what you're looking for isn't there, your next logical step is going to be go to the states. You can do that in the reverse system. I don't know if every state has it, but at least a majority of states are also going to have some sort of legislative search function. Kyle, maybe you can help out with what Florida's is called, for example.
Yeah, so we have the Florida Senate and the Florida House of Representatives, both websites. You can go and just do, as Calvin mentioned, which type in the bill number. I'm always very careful when we put out action alerts, though, to make sure that it's understood that this is a federal bill or a state bill. And typically, like Calvin said, too, if it's a Medicaid issue, chances are it's going to be state, but it can be a little confusing for first-time or novice advocates, but certainly going to congress.gov or going to your state legislature's websites to find out whether it's state or federal is the best way to go.
Now, just to add to that, from NAHC's perspective, everything we're going to do is going to be at the federal level. So if it's something coming from NAHC, you can rest assured that it's going to be federal. Kyle's in a bit of a different situation. All the state associations hold a different position, that and those action alerts that they send out could be federal, could be state. So that's something to pay attention to and make sure you know what you're getting yourself into.
Yeah, absolutely. We sent out a Build Back Better call to action today, actually, to our email list. So pushing federal things that actually will have an impact on the state level. If the Medicaid gets that 10% bump made permanent, it is, while a federal issue, it would certainly benefit providers here at the state level.
Yep.
Going through the Medicaid program.
Yeah, we're going to dig a little bit deeper into that. So I'm glad that you primed it for us.
Mm-hmm.
So going back a little bit between the differences between state and federal, I kind of skipped over Davis in this last question, so I'm going to go out of order and let him answer this one first. Davis, one of the things that I have heard, not frustration about, because all of our legislators are really great, but let's say you go and you want to talk to a state rep about something federal, and he'll say, I can try to help with that, but there's really not a lot, of room I have there. So what is the difference between our state and federal legislators, and when should our advocates reach out to either or?
Sure. Well, thanks for the question, Summer, and good afternoon, everyone. It's a good question. I mean, a lot of the nomenclature and vocabulary is similar across the state and federal sort of policymaking apparatus. So it's very easy to sort of get confused, especially when you don't do advocacy as your full-time job. So anyone who has had those confusions, don't feel bad, because we've all been there and we all continue to be there a number of times. But there's a number of differences. So again, Cal mentioned that NAHC really focuses on the federal advocacy, and that's where we focus a lot of our resources, time, and energy. So when we're talking about federal legislators, we're talking about Congress. Again, we've already mentioned senators and representatives on both the federal and the state level. In Congress, no different, right? Senators, 2 for each state. Representatives, the U.S. House of Representatives, there's 435 of them. The number varies based on the size of the state's population. But again, collectively, they're making up our national Congress. They're, of course, seated here in D.C., up on Capitol Hill, where Cal and I do a lot of hanging out. And again, that's where NAHC focuses a lot of our policy work. Now, the federal representatives, the members of the U.S. House, they're elected. They're supposed to represent the needs and priorities of the people who live in, what's called their congressional district. It's really their geographic backyard, right? So, they need to ensure that their district's needs are really part of the federal policymaking process. That's what the federal representatives are supposed to be focused on. State legislators, senators, and representatives, they really have jurisdiction within the confines of their state. They don't necessarily have a ton of sway or legal authority over federal matters. I think before we were talking on this webinar, someone mentioned that, if you reach out to a state legislator about a federal issue, they may be able to connect you with someone, or, they might know someone that works in DC, but they're not going to have legal authority to legislate anything that's at that federal level on the policy front. But again, they do focus on those issues that are important to sort of their local constituencies. Just a little more color there. Again, focusing on the federal, because that's where NAHC spends most of our time. For representatives, I think it's really important to know that a lot of the agenda setting, a lot of the priorities at the federal level are driven by leadership in the chambers. So on the House side, we're talking about the Speaker of the House, and their membership, their leadership team. They have a lot of control over how that chamber operates, whose voices get heard, ultimately what types of legislation get introduced and voted on. So, as the world stands today, power is pretty concentrated there in the House, which is why a lot of advocacy is targeted to members who are in the leadership positions there. Kind of the same deal on the federal level for the Senate. Of course, there's not as many senators as there are representatives. Every individual senator is extremely powerful at the federal level. Really, any given senator can have influence on legislation. It's not as leadership driven as the House. They do have a leadership structure for sure. But again, each individual senator has a lot of power and influence over the legislating process at the federal level. The most important thing to know, though, and I think this is the case for most state legislators as well, is the interplay between both the House and the Senate. And neither can pass laws or legislation on its own. They ultimately have to pass the same version of the same bill. And then at the federal level, the president has to sign that version as well. Only until those three things happen can something become law. So really, it's all about compromise. And for advocacy purposes, it takes an all of the above approach. You need to be aware of the dynamics between the different chambers, so that you're really attacking an issue from a comprehensive perspective.
Mm-hmm.
Thank you. Kyle, I'm going to ask a question that again, we didn't prepare for, but that's coming off the tail end of that. So he kept using the word chambers, right? Because we have new people who are unfamiliar with how it all works. Can you just quickly give a rundown of what he means by that and who fills those chambers?
Sure. So the chambers is going to be in every state. There are two, with the exception of Nebraska, which just has it's a unicameral or just one chamber legislature, which is the Senate there. So in every state, there will be a lower house and an upper house, or lower chamber and an upper chamber rather. And so typically that's the General Assembly is the lower, or the House of Representatives. They are typically elected at 2-year intervals or shorter intervals than the senators, and there are going to be more of them. So in Florida, we have 120 state house districts, and those House members represent about 180,000 constituents each. In the Senate, we have 40, so that's the upper chamber. They're going to have a larger district, but that's the more kind of deliberative body that will be elected maybe every 4 years or every 6 years. But those two chambers, they're going to have the lower chamber that's going to the House or the Assembly, that is going to be really more responsive to the needs of their constituents. Whereas that upper chamber, again, is more deliberative, more thoughtful, long-term, kind of more considerate of issues going forward and not so knee-jerk, for lack of a better word.
So for clarification purposes, just to sum it up, and at the federal level, we have a House and Senate, and also at the state level, you have House and Senate.
Except for Nebraska.
Yeah, except for Nebraska. Awesome. Great. So I think we've got the basics there out of the way. And so we have the fly-in coming up, the March on Washington. And for people who are getting new into advocacy, or they have joined their state association, or they're coming with us on NAHC, which that's my plug, we'll get to it at the end. They come in and we ask them to go advocate with us. And now they know the difference of who they're going to go talk to. But then they walk in to these offices and they don't see the people that we've telling them they're going to meet with, right?
Mm-hmm.
Do they see when they walk in who is actually in their offices deciding on healthcare policy for them? Who do they need to build a relationship when they get in that office? Can you guys kind of break that down? And I'll go back and I'll start with you, Davis, on this one.
Sure. So you're right. And, we talk about the members of Congress or the legislators themselves as like almost proxies for their offices, for the issues they work on. And it's not always guaranteed and not even likely that, just a one-on-one advocate who's coming in for a fly or something is actually going to meet with the legislator themselves. That's terrific. If we can do that, it's fantastic. If you can engage directly or build a relationship with the elected official themselves, senator, representative, Those of course, they're the head honchos. They're the people that actually have the decision-making power over the issues you care about. Again, however, it can be very difficult for advocates to actually secure face time with the members themselves. That's totally okay. It's totally normal. Members of Congress have huge staffs who help sort of run their office, and they're responsible for working on certain issues in certain areas that their boss, the member of Congress, care about. And there's a real, sort of division of labor within the congressional office. So, in our world of care in the home, we are most often engaging with the staff person who handles the healthcare portfolio of issues. And it's important to note that very rarely are you going to get a staffer who only and exclusively focuses on healthcare. They may work on healthcare and trade and education and a number of other things. So it's important to know going in, you really will know home care like the back of your hand. That's what you do day in and day out. This person will know policy. They'll have probably a high level understanding of some of the umbrella issues you're talking about, but you shouldn't expect that a healthcare staffer will know as much about the operational specifics of what you do day in, day out, or even the policy specifics of the issue that you're bringing to them. They may, a lot of great staffers will do a lot of prep work, but again, they have large portfolios that span more than just healthcare. But it is that person who, as part of their duties, does have the healthcare portfolio that's one of the most important people to build that relationship with, because they're going to be the day in, day out sort of workforce for the member on the issue you care about. Formerly, they're usually called legislative assistants. In DC, everything goes by an acronym, so it's LA, legislative assistant. So the health LA, you may hear that term thrown around. That's the health staffer for an office. They're usually super smart. They're usually quite young. I think a lot of people who are doing advocacy the first time in DC are sometimes surprised at how young some of the staffers are. But again, they're really smart, they're engaged, and they are really important because they can help flag your issue for the boss. They will take your meetings, they'll take questions, and they'll ultimately, pass on whatever you guys talk about to the member of Congress. And so that's what it's really all about, right? We're looking to educate members on our priorities, secure their support. That could mean support could mean a lot of things. It could mean writing a letter. It could mean attending an event. It could, ultimately mean introducing legislation and so on. But the staffers are really important sort of gatekeepers to the members. So it's important to build a relationship with the Health LA. Just quickly, as I said, there's a large staff for most congressional offices. These Health LAs have bosses. They come in various roles, various titles, but they're certainly farther up the ladder than a Health LA. And, you may have a position called a legislative director or an LD, or even the chief of staff at a congressional office. Really powerful people within a member's office. Again, it'd be great if you could develop a relationship with those folks as well. Often those come through kind of roundabout ways because you'll be routed directly to the health staffer. But just a general plug for developing relationships with the person that handles health. But if you don't want to stop there, don't stop there, because the more relationships you can catalyze within office, the better, because they surround the member in a really sort of holistic way.
Awesome. Calvin, adding on to that, first off, this is why you hear the term, right, that our nation is ran by a bunch of 25-year-olds. Do you say that's where it comes from? But also, how long, in trying to build a relationship with these LAs and these LDs, how long do they usually stay in these positions, and what happens to be their next step more than likely after they graduate from one to another? So when we're telling these advocates build a relationship, is there frequent turnover? What does that look like?
Yeah, upward mobility, if you will, on the Hill is crazy. Oftentimes the person's only in a job for a year before they're getting promoted. That's because somebody's left a job or been promoted themselves. So you might have somebody, as Davis mentioned, that was in LA, but they were more junior staffer before that. Their next step is going to be the LD, the legislative director, or maybe the chief of staff. Maybe they go to a committee of jurisdiction. We'll talk about those more later on. Maybe they go to another office. Maybe they go to a job like, the three of us have it. And you think that maybe they're out of your world at that point, but that's not necessarily the case. They'll come back too to the Hill. You've probably heard the revolving door term, where staff of any sort, generally speaking, congressional staff will go do a job in the private sector, but then come back to the Hill later on. Maybe sometimes for the same member that you're working with right now, maybe somebody else in the state. I think that's pretty common. So if you've built a relationship, don't think it's necessarily over if that person leaves that job, because they could very well come back in a more senior position. One other one I want to piggyback on what Davis was talking about with the staffers to build relationships with. This one is so overlooked and not understood very well, but the scheduler. Bonus points if you can build a relationship with the senator scheduler or the representative scheduler. It's hard to do, but if you email that person and already know them, there's much better likelihood you'll get in with that member of Congress or get a more preferred time or maybe a longer time in a meeting with them too. So again, it's hard to do that, but if you do have that opportunity, do try and take advantage of it, build that relationship as well, because it will pay off in more ways than one.
Awesome. So to sum this part up, if one of our advocates decides that they're going to just get the courage and they're going to go advocate and they're going to reach out to that office, and they're not going to get discouraged when they don't get to talk to Ted Cruz himself, right? They have somebody, intervene and they set up the meeting with the LA or the legislative assistant for healthcare policy. They're going to walk in, not probably expecting, but be surprised and excited if they do get, the legislator themselves. And they're never going to burn a bridge with that person because they're probably going to come back even if they leave in a year.
Yep.
Is that a great way to sum it up?
That's the gist. And one other thing I'll add, let's say you're from Texas or you're from New York or California. If you're one of those states with larger population, getting in with your senators is going to be very, very, very difficult. There's just so many people. But if you're from Wyoming, Rhode Island, the smaller populations, that's when you might already even know the senators personally. We hear that all the time. People have those personal connections just because it's less competition essentially. So don't get discouraged if you're getting pushed off to a staffer. That is absolutely the norm. And then one other note, if you meet with that staffer, what they're likely doing is taking notes on what you're presenting to them. They're going to go do some more research, get some more background information. They're going to try and talk to some other folks, their stakeholders, try and figure out if there's any opposition to what we're looking for. And they're going to write up a memo on this and then give their recommendation or their advice. And that's what ultimately gets passed along to the senator or to the congressman. And that's how they'll make their decision on, do they support this measure? Do they sign on to the letter? Do they vote in favor or opposition to it? That's kind of the behind the scenes work that's going on.
Thank you for that. Kyle, I'm going to insert one of these questions that you weren't prepared for, so I'm going to hit you with the next two. He's talking about senators, right? He just brought it up, so it made me feel like we hadn't quite clarified it as well as I would like for some of the people on the call and those that are going to be watching. You have senators and you have House reps. What's the difference between the two, aside from the chambers, right? But what do they work on differently? Why don't we just have one across the board?
So senators versus representatives?
Yes.
So the senator is going to imagine a state like Florida where we have 29 members of the congressional delegation. So that's 27 representatives that represent about almost 800,000 people. If you've not been to Florida, South Florida is a completely different place than North Florida. So the economies, the demographics, the needs for those districts vary greatly. And that's kind of similar in a lot of states. But at the statewide level, those two senators have to look at the entire state. So that's where the compromise comes in, trying to look to Miami and find out how you can find a compromise on any given issue between that and Gainesville, perhaps. So I think that in the representative in the House chamber, they are very directly responsive to the needs of that district they represent. Some of them can be huge depending on whether it's a rural district or urban. But the statewide, they have to look at all of those variables.
Thank you for that. So going on to the question you're prepared for, we finally have figured out how we're going to walk in. Now, on this webinar, most of the people on it are for home health, hospice, private duty, which really is direct funded from Medicare and Medicaid, right? Mm-hmm. So now that we've figured out how we're going to talk to them and who we're going to talk to, who do you advocate on for Medicare versus Medicaid? Are you going to go to both of them for the same? Let's say, are you going to go to your state rep or your federal rep for Medicaid? Or are you going to go to both for Medicare? Can you speak to that real quickly?
Sure. So going back to the Build Back Better Act, that is a federal bill that would give every state a permanent 10% add-on to the FMAP to where to support home and community-based services, which is huge and something that happened as a result of this pandemic we're still trudging through. So you would talk to your federal representative or your your U.S. senator about signing on to that bill. At the state level, of course, we would benefit from passing that legislation and drawing down those dollars. But if it's Medicaid specific at the state level, which every state has a different Medicaid program, if it's something like wanting to increase Medicaid reimbursement for home health, you're going to go and talk to your state representative and your state senator. Your agency, your state agency perhaps could ask for additional support if they're seeing that there are cases that are slipping through the cracks they can't staff. So there are stakeholder groups outside of the state legislature, but primarily for reimbursement for anything getting Medicaid enrollment, for instance, you would talk to your state legislators.
Awesome. So let's go a little bit further. I'm going to tag team off of what you're saying now, and then previously when Calvin said we're going to talk about committees. All of these guys are on different committees, guys and gals. Don't forget the ladies in there. They're on different committees. And so you hear that, and we talk about committees of jurisdiction, and they're on the Ways and Means committees, and all of these terms fly around. And for the new advocates that are just trying to figure out who's who, that also can add a layer of confusion. So, Davis, I'm going to give you this one. Let's talk about the difference in committees on both levels. What is a committee? What do they do there? Why is it important for us to know the difference?
Sure. Yeah, committees are really important entities to be aware of. From an advocacy perspective, they're basically just organized groups of I'm speaking primarily from the congressional standpoint here at the federal level. I think it works similar at the state level as well, though. But committees are really just organized groups of lawmakers that focus on specific issues. Right, when you think about the scope and the diversity of topics that government has to deal with, it's just massive. It's basically from the second you wake up to the second you go to sleep. Everything you do, there's an overlay for the government to work on. And so no sort of single legislator can be an expert in all things. And the committees really help organize the work of legislatures, including Congress. Committees have their own sort of expert, professional, permanent staff. And again, they help facilitate the day-to-day work of legislating. They chunk it down into sort of discrete issue areas that each committee works on. Excuse me. Now, in Congress, there are, I think, 3 types of committees. There are standing committees. These are the ones that we focus on mostly here at NAHC. They're the permanent committees that have really delineated specific responsibilities for certain issues that are laid out in the rules of each chamber. So whether it's a committee on the House side or a committee on the Senate side, the rules that govern how the House or Senate operates spell out what issues the standing committees work on. For NAHC, the ones that we most often work with, again, are standing in the House side. It's the Ways and Means Committee, and the Energy and Commerce Committees. Talk a little bit more about that in a second. On the Senate side, it's primarily the Senate Finance Committee and the Senate Health, Education, Labor, and Workforce, or again, another acronym, HELP, the HELP Committee. So those are on the Senate side. The second type of committees are special or select committees. These are committees that are created for specific purposes. Could be an investigation. I think one that folks will be familiar with, recently there was a select committee in the U.S. House on January 6th, right? It was a time-limited committee. Some of these select or special committees are time-limited. Some of them, however, are a little bit more long-lasting. For example, there's a special committee on aging in the U.S. Senate. That's actually a permanent committee. As the name suggests, it works on issues impacting older adults. The key difference, though, between special and select committees and standing committees is that the special and select ones, they don't have legislative authority. So the Senate Aging Committee doesn't have power like the Finance Committee or the Help Committee I mentioned earlier to actually develop and advance legislation. So they're important, but they're just not as powerful when it comes to the actual machinery of legislation and legislating. And then finally, there are joint committees too that are often formed for both members of the House and Senate when they come together. And they're, as I said, they're super important entities. Generally, members of Congress are assigned to committees by their party based on their sort of particular interests, their expertise, and then the requirements of the committee. Traditionally, the most senior person on the committee from the party that's in power becomes what's called the chair of the committee. The most senior person from the party that's out of power becomes the ranking member. Those are really important leadership positions on committees. They're really influential. The chairs of the various committees are extremely powerful. They help set the tone, set the priorities for what issues the committee is going to work on. And just nuts and bolts, committees are really where a lot of the hard work of writing, introducing, revising actual legislation happens. Bills can get introduced by any given member of the Congress, House or Senate. They get sent to the appropriate committee based on the jurisdiction of that committee, and that's a term I'll cover here in a second, committees of jurisdiction. And they get sent to the committee for further consideration. And actually, a lot of legislation can originate in the committees themselves. Committees are responsible for doing things like they'll hold hearings on important issues. These could be issues from an existing bill that's out there or various bills that are out there. Sometimes it's, an issue that's not actually in legislation yet, but Congress is hearing a lot about it, maybe from the media, maybe from stakeholders. So they'll hold a hearing, and then sometimes bills are written in committee in the wake of a hearing. But regardless, it's where a lot of the meat and potatoes work of legislating and advancing bills and progressing them through the Congress happens. Now, we've thrown around this term committees of jurisdiction a few times. It's really what it sounds like on the face. A committee of jurisdiction is just a congressional committee that has formal authority over certain issues. It has jurisdiction over certain issues. So for our world, the committees that oversee things like Medicare, Medicaid, those would be considered the relevant committees of jurisdiction for our advocacy efforts. And I touched on the four that are most relevant for our day-to-day at NAHC on the congressional side. That's in the House, the Ways and Means Committee, which is one of the oldest and most powerful committees, and the House Energy and Commerce Committee as well. Ways and Means has jurisdiction over most of Medicare policy, so Medicare Home Health, Medicare Hospice. Energy and Commerce shares a little bit of jurisdiction over Medicare, I believe. There's some Part B, which is not Home Health and Hospice, but there's some Part B payment and policy issues that Energy and Commerce works on. I'm also working on some Medicaid issues. On the Senate side, the key committees of jurisdiction are the Senate Finance Committee, which has jurisdiction over Medicare issues, payment policies, things like that, where NAHC focuses a lot of our advocacy, and the Senate Help Committee, Health, Education, Labor, and Workforce. That committee works on, I'd say in our space, the key issue that Help has jurisdiction over is workforce issues. That's top of mind for a lot of people. So Help has jurisdiction over training, education. In my space of hospice and palliative care, for example, the Palliative Care and Hospice Education and Training Act, PACHETA, which folks are familiar with probably, that's a Help jurisdiction bill. So it's important to be aware of the committees. It's really important to know the members of Congress who are on the committees because they're very influential in dictating what the priorities are, what issues get raised, what bills get introduced, what bills get passed through the committee and ultimately onto the full sort of consideration of each chamber. So I'm sure Cal and Kyle have other insights to weigh in, but that's a brief overview.
Yes. I'm gonna pick on them for a little bit. So in summing up what you said, basically every legislator is assigned to a committee of some sort, right? And based on their experience and based on what they truly care about. And so we need to know as advocates who are on which committee. So if I'm in Texas and let's say Dr. Burgess is mine, I need to know what committee he sits on, what types of things he cares about, how active he is in that. And I need to go to him for things that he really has jurisdiction over. So for instance, if he is obviously he's a doctor, so he cares about healthcare. But if he didn't necessarily care about, gun control or foreign affairs, I wouldn't go to him if he sat on a healthcare committee of jurisdiction, correct? You have to really know, or not correct.
You could certainly still
It's-
go
yeah.
to him, but he won't.
You want
he won't
their
have that same
sponsorship.
direct sort of foundational influence that somebody would on, let's say it's an agricultural issue, because he's not on
Right.
the ag committee, he would not have that same immediate impact. But because he's healthcare, being on energy and commerce, he would have that immediate impact.
Right.
Right. And
So go ahead.
I think at the federal level too, just if whenever we've had meetings, if someone doesn't serve on a committee with jurisdiction about a Medicare home health issue, for instance, they may not be able to have that voice in a committee, which Florida, unfortunately, we have, like I said, a very large delegation, but I think 7 now serve on committees, those committees with jurisdiction, even though we have the largest proportion of seniors in the nation. Makes no sense. But that aside, yeah, they still do have the ability at the federal level where it's impactful for them to co-sponsor legislation, which helps it move faster through the legislative process. And then, of course, they can vote when the bill comes to the floor after it's gone through all of the committees that it's been assigned to. So that still matters as well.
Right. Thank you for that. That was attached to my question is, I don't want our advocates to think that because their particular person doesn't sit on a certain committee, we don't want them building relationships with them because they might be the one that pulls it through at the end if they're a tie vote.
Right.
So
And-
I wanted
and-
to kind of.
Summer, I just wanted to add on something, sorry to interrupt, just to tap
No, go
into
ahead.
what you said. I mean, I really think we need to hammer that home, which is, talking to any and all members is important, especially if you're their constituent. It's their job to, respond to your issues, to hear you out, and they may, excuse me, you may have a very particular local issue that your congressman or your senator may be interested in being able to help with. It's also important because while they may not sit on the committee now, they could always go on the committee later. They could become committee members. So to the extent that you would talk to them 2 years before they got on committee and you had been, bending their ear about home care and hospice, they're going to have a sort of a track record of an understanding that issue. And so you don't have to start over from when they are in that more powerful position, more influential position on committee.
Thank you. And we will also see sometimes when we go visit them, if it's something they're not familiar with, let's say it's a healthcare bill, but your congressman, that's really not his gig. He might have a partner that he really depends on that might sit on one of those committees that he will say, I'm going to check with so-and-so and see, what their thoughts are on it, because he might feel like he's not educated or doesn't have enough, expertise in this area to give you an answer right then. So our advocates shouldn't feel discouraged when they hear that come out of their mouth either. So Kyle, going back to Medicaid real quick, because I want to spend some time on Medicaid.
Mm-hmm.
You broke down the differences of when Medicaid becomes a federal issue, if it's like a FMAP add-on, but there's also state level issues. So I think Davis broke down, Medicare for hospice, but where do you go to? What are your committees for, Medicaid at the federal level? Where does that fit in?
So those would be the same committees, generally the same committees that Davis listed for Medicaid at the federal level. At the state level, it changes. In Florida in particular, we have 2 committees in the Florida Senate, and then I think 4 in the Florida House. And so they will all deal with healthcare spending, and Medicaid, of course, is the primary spender in healthcare at the state level. So we'll work with those legislators and everything that Davis said, working with the leadership, being that it is also leadership driven at the state level, depending on how often the legislature meets. Here in Florida, it's 60 days a year. In most states, it is going to be a truncated short session. And in some states, they also meet every other year. So working with the leadership and those who serve on health committees as it relates to being able to get something accomplished, Medicaid related or anything related, anything policy related at the state level is pretty key.
Thank you for that. And I'm going to skip around since you brought it up. So we just entered a new Congress, right? And I feel like some of our advocates, at the end of last year, we were trying to get bills pushed. We were really heavy on asking them to do things, sign this, send this letter to your congressman, do this, show up here, come in for the fly-in, and then a new year hits and we kind of get quiet. Why don't you speak to that? What happens when a new Congress comes in? What all changes? Do we have to start all over? Do new bills have to be reintroduced? Please just take a couple of minutes and talk about what that means.
Right. So we are now in the 118th Congress, and so that every election every 2 years, even numbered years, we just had the midterms. So the 2022 elections, after the dust settled and we found out who the 435 House members and 100 senators were going to be, the 117th Congress officially adjourned, and the new members who were elected or weren't up for re-election were sworn in. That was on January 3rd of this year. So that new Congress comes in. It just so happens that the previous congressional session, we had Democrats controlling both chambers. Republicans managed to take control of the House. So new leadership, the Speaker of the House was installed. The new committee assignments were doled out. They just finalized those. And so any legislation that was outstanding up for consideration at the end of a Congress that doesn't get passed is considered a dead bill. And so unfortunately, we have to go back and reintroduce it. So things like, the Preserving Access to Home Health Act that would have stopped the cuts from going into effect isn't necessary now that it's already being carried out. But things like Choose Home that we will be working on, I'm sure Davis and Calvin can speak to that. That has to be reintroduced, and maybe we can find reasons that it didn't get the steam to be able to get across the finish line last Congress. Then we can maybe make some tweaks to the bill, find more powerful or more impactful sponsors, things like that, to hopefully be able to get that passed and ultimately signed into law. But that is where we are now. So the new committee assignments have been announced, and you can go to, for the House, it's house.gov, and you just go to the Representatives tab, find your state, and it has the list of all of the legislators, and it'll tell you the committees they're assigned to as well.
Awesome. And then you can go to their individual websites, correct, and find out which committees they sit on.
Yeah, it's usually the format is their last name dot house.gov. So yeah.
Thank you for that.
Mm-hmm.
And in talking about the Congress ending and a new and beginning, sometimes there's some things in there that make it even more difficult, correct? And it might be a loaded question I'm going to ask we need to save for the next webinar. But let's talk about just the preserving access to home care. From one Congress to the next, do things change? Like, if you have a bill in last Congress, it may have to be updated because a new Congress changes something in there that it needs to go back to Legislative Council and get rewritten. Is there anything between two Congresses that might have to have a bill redrafted?
I would say one thing, if we don't have for the Choose Home, for instance, going to that bill, without there being a price tag showing what that's actually going to cost, or a score as it's called, it's difficult for some legislators, the more fiscally conservative legislators, to be willing to sign on to something for an entitlement program that some of them think is going crazy. And when MedPAC's in the background saying that we have 25% profit margins, they're not exactly looking to pass something without seeing what the actual bottom line might be. So that's something that we can actually try to get that score, that cost. That could be more appealing if we can show savings because of passing this legislation, or access to care that's going to be in the home or community instead of more expensive facility-based care, for instance. I'll let Calvin and Davis tack onto that if they have anything to add.
I'm going to ask Calvin a question because you went exactly where I wanted you to go about the CBO score. We throw that around. Our advocates are going to get asked that, and some of them aren't going to know what it is. I mean, that's the first question when they walk into an office. Well, what's a CBO score on this? And they're like, well, first off, I don't even know what a CBO score is. And so, Cal, can you kind of talk to that and tell everybody what a CBO is and elaborate off of what Cal just said?
Yeah, so that stands for Congressional Budget Office, CBO for short, obviously. What they do is they're kind of the official scorekeeper, designed to be a nonpartisan body that advises Congress on how much does a piece of legislation cost, how much would it save. They'll go beyond that. Take healthcare, for example, let's say an access to care. How many patients might lose Medicaid access? How many might gain Medicare access? Those sorts of things, to get like a full understanding of what the ramifications of legislation would be. There's a lot of arguments on their calculation methodology and what they do and do not consider. And those are valid arguments, but at the end of the day, they don't really matter once there's a real score produced, because that's what Congress is going to operate off of. So we can argue that, they didn't include this or they overlooked that. And true as that may be, Congress can say, well, this bill is going to cost $1 billion, or it's only going to save $100 million, and you guys need more than that. So that's why that's so important. You get certain members of Congress that are very fiscally sensitive, that don't want to add anything to the federal budget, federal deficit, and they will always want to know what CBO has to say about things. CBO can be, they'll work with the different federal agencies, in our case, CMS, and getting some analysis on what CMS thinks. But, again, this is a nonpartisan body that advises Congress and Congress alone.
Yeah, and one other thing to add to that, in addition to the cost of any kind of legislation, a key question that always comes up from these meetings is who would oppose this.
Yeah.
So the legislation, like whenever the Choose Home bill was coming out, NAHC was great at rounding up all of the list of supporters. AARP, I think Leading Age was on there,
Yeah.
being able to show that there is, widespread support for the legislation, and being able to rule out any question as to whether one group would oppose this is really important to showing the strength of the bill and why it needs to have their support.
That's a great question, because they do get asked that every time they go in. And I think that we could probably, and hopefully we will, work with our advocates to better prepare them for some of those questions. So sometimes they're nervous and they go in and they get asked these questions and they're like, they didn't prepare me for this. So one of the things that, we can all commit to is making sure that we do have, a fact sheet or some list of questions and answers that you're going to get asked, so that you don't have to stumble over your words or act like you don't know. So you guys have been great. We're going to not sum it up. We're going to go to questions in a minute if there are any. But before we do, I wanted to ask you guys, because of your experience, for the new advocates on the call and the ones that will watch the recording, what kind of tips do you have? And I would like all of you to answer this if you don't mind. We'll just go from Calvin, Kyle to Davis. For a new advocate, for somebody who is not you, who doesn't have the background that you have, that would show up for a fly-in or would show up for one of your lobby days in Florida or at your state, what would you tell them?
I would hammer on the relationship building. We talked about that earlier with building relationships with the staff. That's so important. But also try and get with the member of Congress themselves and position yourself as a resource for these people, so that if anything, home health, home care, hospice, what have you ever comes up, that you're the first person they think of when they call you and say, hey, I saw this new piece of legislation introduced. What would this mean to you? And there's a lot of different ways to build relationships. A lot of you probably heard me talk about this stuff before, but you can go to community events, fairs, high school football games, parades, all that stuff. They're typically there and present. A lot of them will hold events called Coffee with Your Congressman, where they'll build out a schedule for 5 to 10 minute increments. You get on the schedule, you get to go in and talk about whatever you want. There'll be town halls time to time. You can always go to their district offices. Typically, they have 2 or 3 offices spread out across the district or across the state. You come to the DC office. But these are all great ways to get in front of these people, build a relationship, make yourself a known entity, and certainly as a resource for them.
Thank you, Kyle. What about you, Kyle?
I would say, in addition, I totally echo everything he said, but I think also, whenever you have those conversations, make sure you keep it as local as possible. Talk about the impact on the community that representative or senator, even in the state level, represents. Talk about what the impact is on your business, on your staff, those kinds, and more importantly, on your patients and your clients. Talking about how many people can stay in the home, the fact, if it's a workforce issue, what we're leaving behind, or what we're having people to go to the hospital or go to a SNF because they can't get care. That's important. That kind of data is very impactful. And the last thing is, whenever you went back to the fact sheets and when you get questions you don't know the answer to, that's okay. We know you're the experts when it comes to the provision of care. But if you don't know something, just say exactly that, and be sure to follow up with them. Reach out to us, your state association, and get that information and send it to them. But it's okay to say you don't know.
Love it. I love it. Davis, what do you got?
Well, I'd agree with this is the danger of going last after 2 people way smarter than me. I'd agree with everything they said. Just maybe to tag on to Kyle's last point here about sort of it's okay to not know everything. I'd just say, from a motivation standpoint, don't let the fact that you don't know everything or you don't know every acronym get in the way of, you feeling like, oh, everyone else must know all this stuff. It's not the case. And you, as Kyle said, you're the expert in the actual issues that the 3 of us are here advocating on. I've never been bedside. I've never operated a home health or hospice. So you really have the expertise, and staffers, members, committee staffers, and so on and so forth, they will give you as an advocate with firsthand experience a lot of grace. They understand that you're not a professional lobbyist and you don't need to be. So that's just a plug to it. But I mean, your voice is so powerful. It's oftentimes way more impactful than what I may be saying over. It's a dance. We need to help support each other's advocacy, but the really good organic ideas, the motivation for a member to do something is often coming from folks like yourselves, actual constituents, advocates. And our job is to help translate that, support it, provide you with education like we're doing hopefully today, to soak you in some of the vocabulary and behind the scenes stuff that helps you get a little bit further advanced in understanding the process. But, the experience trumps the process for sure. So I just put that plug out there. If you're feeling like, you have an imposter syndrome on this, don't. We've all been there. We all are still there. And just reach out to your associations, NAHC included, and we can answer any questions or address any anxieties you may have, because you definitely already have the tools you need to be an effective advocate. It just takes reaching out.
Mhm.
Awesome. I've had two questions come into me that I'm going to ask. Somebody asked, so they have legislative assistants and they have different offices in their state and then sometimes in Washington. So will they have to build relationships with both of those people, or do they connect them? Kyle, can you take this one?
Sure. Did you say Cal or Kyle? Sorry.
Kyle, sorry. That
Yeah, so
Texas-
the DC office is going to be really where all of the policy work is actually carried out. I know here where I'm in Tampa, my congresswoman, her chief of staff actually is in Tampa, which is unusual. But for the most part, all of the legislative staff, everyone will be out of the DC office. The state offices are going to be doing more casework, things with issues obtaining a passport or immigration issues, things like that. Any issue that you would have with the federal government, Social Security issues that are personal to an individual, a constituent would go into the office, and a caseworker would be there to work through that by contacting Social Security or whatever the office might be. So at the state level, though, there are going to be some community affairs staff, depending on if it's a Senate office, they'll definitely have that. That'll be the person who kind of goes and meets with local governments, goes out to meet with various organizations, shows the senator or representative around whenever they're in the district, and going to various events. But for the most part, especially with congressional, it's going to be mainly casework. Some of them will have that kind of community affairs person, though. But it doesn't help to make or to build a relationship with anyone in any of these offices.
Thank you for that. And then I'm going to let any of you take this question. We hear often about a unified voice. So is there any danger in, let's say, me who owns a home health agency, I have an ask, and then another person who owns a home health agency has a different point of view about a certain bill, like I want it passed and they don't. What's the importance of a unified voice in advocacy from the state and the federal level, from state associations to NAHC? What's the importance of the unified voice?
If we don't have one voice, we get nothing. We've heard that from a lot of congressional staff over the years that, they want their job to be easier. They don't have to sift through and deal with warring factions. So they want a single unified ask that they can operate with. In the moment there is any friction, they don't want to pick sides.
Riley, have anything to add to that?
No, that's essentially the case. I mean, I think of at the state level, we have an Alzheimer's training legislation that's been coming around year after year, and there are other stakeholder groups like ALFs and adult family care homes. Some of them don't like what compromise the Alzheimer's Association has offered, but we all agree that something will pass eventually, so we have to all give a little something, come to an agreement, a common sense kind of consensus-based agreement. May not really like it at the end of the day and want to just say no and dig your heels in, but ultimately you're left behind, and things happen without you having any kind of impact. So certainly whenever we're doing home health agencies or home health professionals meeting with a legislator, not showing that there are split hairs there, because then they won't even take it seriously. They won't consider it if there's infighting within the industry about that.
Love it. So we're going to end with giving you guys some resources. I know that when I started getting involved in advocacy, I had no idea what I was talking about, still don't, which is why I'm friends with these three, and wanted to do this webinar with you guys. But where you can find a lot of information is your state associations, National Association of Home Care. You can go and sign up for the letters for your congressman, see what they care about, see where they're going to be, build those relationships, show up at their events. There's some different podcasts out there. A lot of our NAHC business partners, they put out podcasts. We have a Disturb for home care. Sometimes NAHC sponsors certain podcasts. So listen and take notes. If there's something that comes up that you don't understand, reach out and ask. And then also show up for the March on Washington. Cal, I'm going to let you just quickly put your plug in on the March on Washington that you're scheduling for March. Give them the details.
Yep, so it'll be the 27th and 28th. We're about a month away now. The 27th, on Monday, we will hold a reception from 4 to 5 Eastern time, drinks, some appetizers, that sort of thing. And then at 5 o'clock for the next 2 hours, we will do a briefing and update on what's going on in Washington, what the issues are that we're working on, what sort of headwinds we're facing, and then some tips and tricks for your Hill meetings. On the 28th is going to be reserved all day for Hill meetings. We have an outside group that's scheduling these for us, so all you need to do is register. We've sent out the registration links through the NAHC report, through our social media stuff. It's on the website. Go there, please register. We'll take care of all the meetings, we'll take care of all the logistics from there. We'll group you up with other folks from your states. And really, it's just going to be a great positive day on the Hill.
Awesome. Thank you guys so much. Kyle, Calvin, Davis, you were amazing. If you guys have any questions, their emails are here and you can reach out to them or any of us. And then lastly, I just want to encourage you to get out there and advocate. I have a dear friend that says, closed mouths don't get fed. So if you don't speak up and you don't go ask for the things that you need, nobody's going to ask for you. So thank you for fighting with us for home care and hospice, and we hope to see you on the Hill next month.
So, a good one.